Can you walk us through your experience in the operating room?
During my tenure as a perioperative nurse, I have gained extensive experience in all three phases of surgical care: preoperative, intraoperative, and postoperative. In the preoperative phase, my primary responsibility was to prepare patients for surgery, which included conducting detailed assessments, verifying patient information, and confirming the surgical site. I'm adept at creating a calm and reassuring environment for patients and their families, ensuring all questions are answered and concerns are addressed before they enter the operating room. My experience also involves meticulously checking the patient's chart and collaborating with the surgical team to ensure all necessary documents and consents are in order. Intraoperatively, my role was multifaceted. I've worked as a scrub nurse, assisting the surgeon directly by handing instruments and maintaining a sterile field throughout the procedure. Additionally, I've functioned as a circulating nurse, managing the operating room environment, ensuring proper patient positioning, monitoring vital signs, and retrieving necessary supplies. I am highly skilled at performing accurate counts of sponges, sharps, and instruments to prevent retained surgical items. I'm trained to anticipate the surgeon's needs, which is crucial for maintaining the flow and efficiency of the operation. In the postoperative phase, my focus shifted to providing compassionate care in the PACU. I've managed a wide range of patients, from those recovering from minor procedures to complex surgeries. My responsibilities included continuous monitoring of vital signs, pain management, and assessing for any signs of complications such as bleeding or respiratory distress. I have a strong understanding of how to manage postoperative nausea and pain and effectively communicate the patient's status to the surgical team and the next unit of care. My experience across all three phases has given me a comprehensive understanding of the entire surgical process, with patient safety and advocacy at the forefront of my practice.
What is a timeout, and why is it so important?
A timeout is a crucial safety procedure performed in the operating room just before the start of any surgical procedure. It represents a final, formal pause where every member of the surgical team, including the surgeon, anesthetist, and all nurses, stops what they are doing to collectively verify key information. This standardized process is a critical component of the Universal Protocol, which was developed to prevent wrong site, wrong procedure, and wrong person surgery. The timeout confirms three essential points: the correct patient, the correct procedure, and the correct surgical site. The importance of the timeout cannot be overstated. It serves as a final checkpoint and a moment of shared accountability among the entire team. By verbally confirming the details together, it eliminates any potential for miscommunication and ensures that everyone is on the same page. This simple yet powerful practice significantly reduces the risk of serious medical errors, which can have devastating consequences for the patient. It reinforces a culture of safety where every team member is empowered to speak up if they have a concern or notice a discrepancy. For example, if a nurse notices that the patient's ID band doesn't match the surgical consent form, the timeout provides the perfect opportunity to halt the procedure and address the issue before it's too late. It is a fundamental practice that promotes patient safety by preventing preventable errors and is a non-negotiable step in modern surgical care. My experience has taught me that a thorough and effective timeout is the cornerstone of a safe surgical environment, and I always take this step with the utmost seriousness.
How do you prepare the operating room for a patient with a specific allergy, such as a latex allergy?
Preparing the operating room for a patient with a specific allergy, especially a serious one like a latex allergy, is a critical part of ensuring patient safety and requires a systematic approach. The process begins well before the patient arrives in the surgical suite. First, I would meticulously review the patient's chart and surgical schedule to confirm the allergy and its severity. This information is typically flagged in the electronic health record, but I always perform a double check. Communication is key, so I would verbally confirm the allergy with the entire surgical team, including the surgeon and anesthetist, during the preoperative briefing. Once confirmed, the operating room itself must be transformed into a latex-free environment. This is a comprehensive process that goes beyond simply avoiding latex gloves. I would ensure that all team members use non-latex gloves, and all equipment and supplies that come into contact with the patient are confirmed to be latex-free. This includes everything from anesthetic masks and breathing circuits to instrument handles, tourniquets, and even the adhesive on tape. Any item that is not certified as latex-free must be replaced with a suitable alternative. I would also cover all surfaces with a latex-free barrier and post clear signage on the operating room door to alert anyone entering that a latex-allergic patient is inside. During the procedure, I would remain vigilant, continuously monitoring the patient for any signs of an allergic reaction and ensuring that no latex products inadvertently enter the sterile field. Afterward, I would provide a thorough report to the post-anesthesia care unit PACU nurse, highlighting the patient's allergy to ensure the same precautions are maintained during their recovery. This comprehensive approach, combining meticulous preparation with continuous vigilance and clear communication, is essential to protecting the patient and preventing a potentially life-threatening reaction.
How do you respond to a surgical emergency like excessive bleeding or equipment failure?
Responding to a surgical emergency, such as excessive bleeding or equipment failure, demands immediate, calm, and decisive action, coupled with highly effective team communication. My first priority in such a situation is always patient safety and maintaining a clear head. For instance, if excessive bleeding were to occur, my immediate response would be to verbally alert the surgeon and the entire surgical team in a clear and concise manner, stating the exact observation and location of the bleeding. Simultaneously, I would anticipate the surgeon's needs, preparing and having readily available additional sponges, suction, and appropriate hemostatic agents. I would also rapidly assess the patient's vital signs and communicate any changes to the anesthetist, ensuring they are aware and can administer necessary fluids or medications to support the patient's hemodynamic stability. Documentation of the emergency, interventions, and patient response would also be initiated promptly. In the event of an equipment failure, for example, a critical piece of monitoring equipment malfunctioning, my initial action would be to assess the immediate impact on the patient. I would quickly communicate the failure to the team, specifically the anesthetist and surgeon, to ensure they are aware of the compromised monitoring. Concurrently, I would immediately work to troubleshoot the equipment if it's a simple fix, or more commonly, I would move to acquire a backup piece of equipment or implement alternative monitoring methods to ensure continuous patient assessment. For instance, if an essential monitor failed, I would quickly obtain a manual blood pressure cuff and pulse oximeter while a replacement electronic monitor is brought in. Throughout any emergency, maintaining a sterile field, even under pressure, remains paramount. My training emphasizes maintaining composure, adhering to established protocols, and fostering seamless teamwork, as these elements are crucial to effectively managing unexpected events and ensuring the best possible outcome for the patient.
What steps do you take to maintain a sterile field, and what would you do if you noticed it was contaminated?
Maintaining a sterile field is absolutely fundamental to patient safety in the operating room, as it prevents surgical site infections and other complications. My approach is based on a set of core principles that I adhere to without exception. Firstly, the sterile field is established as close to the time of use as possible and is never left unattended. Once a field is created, I ensure that all sterile items are kept above waist level, as anything below the waist is considered contaminated due to the difficulty of keeping it in constant view. I never turn my back on the sterile field, as this would break my line of sight and potentially lead to unseen contamination. Additionally, I'm always mindful of air currents and avoid talking, coughing, or sneezing over the field. All items introduced into the field are checked for package integrity, expiration dates, and any signs of moisture before they are opened and presented. If I were to notice that a sterile field has been compromised, my immediate response would be to speak up and alert the entire surgical team. This is a non-negotiable step, as patient safety overrides all other considerations. I would calmly and clearly state the nature of the contamination. For example, the sterile field has been contaminated. The back of my gown has brushed against the non-sterile table. Following this, I would take immediate action to correct the issue. This typically involves removing the contaminated supplies and instruments from the field, as the entire set is now considered non-sterile. I would then work with the circulating nurse to obtain new sterile supplies to reestablish the field. My own sterile gloves would be removed and replaced with a new sterile pair. This process ensures that the surgical procedure can continue in the safest possible environment, and I would also file an incident report to document the event for quality assurance and to prevent similar occurrences in the future.
What steps do you take to ensure patient safety before, during and after surgery.
Ensuring patient safety is the single most important aspect of my role throughout the entire perioperative journey. My approach is comprehensive and systematic, covering the preoperative, intraoperative, and postoperative phases. Before surgery, the process begins with a meticulous preoperative assessment to identify any potential risks, allergies, or pre-existing conditions that could impact the patient's care. I am a firm believer in the power of communication, so I conduct a thorough verification of the patient's identity, the surgical site, and the planned procedure with both the patient and the surgical team. I also ensure all necessary consents are signed and any questions or concerns are addressed, creating a transparent and reassuring environment for the patient. During the surgery, my vigilance shifts to active and constant monitoring. I am an integral part of the team conducting the timeout to verify the correct patient, procedure, and surgical site one final time, a step I consider non-negotiable. I'm also responsible for maintaining a strict sterile field to prevent surgical site infections, a task that requires constant awareness and adherence to protocol. Continuous monitoring of the patient's vital signs and the surgical environment is paramount. I am always prepared to anticipate the surgeon's needs and to act decisively in the event of an emergency, from equipment malfunction to an unexpected change in the patient's condition. After the procedure, my focus remains on a safe and seamless transition. I ensure the patient is safely transferred to the post-anesthesia care unit (PACU) with a clear and concise report to the receiving nurse, highlighting the patient's surgical details, any intraoperative events, and their current status. I then conduct thorough post-operative assessments to manage pain, nausea, and to monitor for any signs of complications. This comprehensive three-phase approach, grounded in clear communication, protocol adherence, and continuous vigilance, is how I ensure the highest level of patient safety from the moment they enter the surgical unit until they are safely on the road to recovery.
Tell me about a time you had to manage a critical patient care issue in the operating room.
Managing a critical patient care issue in the operating room requires a combination of clinical expertise, clear communication, and calm decision-making under pressure. One specific instance that comes to mind occurred during a routine laparoscopic cholecystectomy. The procedure was progressing smoothly until the patient's heart rate suddenly dropped and their blood pressure began to fall rapidly, indicating a significant hemodynamic change. My immediate action was to maintain my composure and verbally alert the entire surgical team. I immediately announced the vital sign changes to the surgeon and the anesthetist, ensuring everyone was aware of the developing situation. While the anesthetist focused on managing the patient's airway and administering fluids and vasopressors, my role shifted to a supportive but critical one. I prepared for potential complications by anticipating the surgeon's needs, such as retrieving additional instruments and emergency supplies. I also provided a concise, real-time update on the surgical field, which was crucial for the surgeon to understand if the issue was related to the procedure itself. Throughout the emergency, I maintained a continuous dialogue with the team, confirming the administered medications and dosages and documenting every change in the patient's status. Once the patient's vitals stabilized, we continued the procedure with heightened vigilance. This experience reinforced the importance of teamwork, the need to anticipate a crisis, and the value of clear, concise communication in a high-stress environment. It's a prime example of how a well-coordinated surgical team can effectively manage a critical event and ensure a positive outcome for the patient.
How do you handle a disagreement with a surgeon or another member of the surgical team?
Effectively handling a disagreement with a surgeon or another member of the surgical team is crucial for maintaining a safe and collaborative environment. In my experience, the key is to approach the situation with professionalism, respect, and a focus on patient safety above all else. For instance, if I noticed a sterile field was potentially compromised and the surgeon did not agree, my first step would be to calmly and clearly voice my concern, stating exactly what I observed. I would say, I am concerned that the sterile field may have been compromised when the surgical tray was moved. It appeared to brush against a non-sterile surface. I would do this in a professional, non-confrontational tone. My priority is not to be right, but to ensure the patient's well-being. I would then provide the rationale for my concern, explaining how the potential breach could increase the risk of a surgical site infection. In a situation where there is a strong disagreement, I would respectfully stand my ground and escalate the issue if necessary, following hospital protocol, which might involve bringing in a senior nurse, charge nurse, or nurse manager to mediate. This escalation isn't about winning an argument. It's about adhering to safety standards and ensuring that the patient is protected. After the situation is resolved, I believe it's important to reflect on the event and, when appropriate, have a private conversation with a team member. This helps to maintain a good working relationship and ensures that future disagreements can be handled even more smoothly. The goal is always to address the issue, not the person, and to work together toward a common goal of providing the best possible care for the patient. Ultimately, my responsibility is to be the patient's advocate, and I will always do so with professionalism and respect for my colleagues.
Describe a time you had to advocate for a patient's needs when they were unable to speak for themselves.
Advocating for a patient is a core responsibility of a nurse, and it's especially critical when the patient cannot speak for themselves due to their condition. A significant time I had to advocate for a patient occurred with an elderly male recovering from a major abdominal surgery. He was nonverbal due to the anesthetic and still disoriented, but I noticed he was showing signs of increasing pain through his vital signs and restlessness. The surgical team had a standard pain management protocol in place, but I felt it was not adequately addressing his distress. I first reviewed his chart and saw that he had a history of high pain tolerance, which might have led to a conservative pain medication order. However, his current situation demanded a more aggressive approach. I approached the surgical resident and respectfully presented my observations, highlighting his elevated heart rate, blood pressure, and nonverbal cues. The resident was initially hesitant, wanting to stick to the protocol, but I calmly explained my clinical reasoning, emphasizing that his vital signs and nonverbal cues indicated a higher level of pain than the standard assessment tools could capture. I proposed a specific adjustment to his medication, suggesting an increase in dosage to better manage his post-operative pain. My communication was direct, data-driven, and focused entirely on the patient's well-being. By speaking up, I ensured my patient received the pain relief he needed. The resident trusted my assessment, the medication was adjusted, and within a short time, the patient's vital signs stabilized, and he appeared more comfortable. This experience reinforced the importance of using my clinical judgment and voice to act as a patient's advocate, ensuring their needs are met even when they cannot express them.
How do you prioritize tasks during a surgical procedure?
Prioritizing tasks during a surgical procedure is a dynamic and essential skill in the operating room, where situations can change rapidly and patient safety is paramount. My approach to prioritization is always centered on a hierarchical model, with immediate patient safety concerns at the absolute top, followed by maintaining the sterile field, supporting the surgical team, and finally, meticulous documentation. Before the procedure even begins, I engage in proactive prioritization during the setup phase. This involves ensuring all necessary instruments, equipment, and supplies are readily available and in working order, and anticipating the needs of the surgeon based on the planned procedure. This upfront organization significantly reduces the need for reactive prioritization during the surgery itself. Once the procedure is underway, my primary focus is the patient's physiological status. I continuously monitor vital signs, assess for any changes in condition, and am prepared to intervene or alert the team immediately if any parameters fall outside the safe range. For example, if there's a sudden drop in blood pressure, addressing that is my absolute top priority over any other task. Simultaneously, I maintain unwavering vigilance over the sterile field, ensuring its integrity to prevent infection. If I observe any potential contamination, my immediate action is to address it, even if it means pausing another task. Next, I prioritize supporting the surgeon and the surgical team. This involves anticipating their needs for instruments, sponges, and other supplies, and facilitating a smooth workflow. I strive to be one step ahead, ensuring the team has what they need precisely when they need it, which directly contributes to the efficiency and safety of the procedure. Finally, throughout the case, I meticulously document all interventions, observations, and key events, understanding that accurate and timely record-keeping is crucial for continuity of care and legal purposes. This multi-layered approach allows me to adapt to the fast-paced environment of the ER while always keeping patient safety at the forefront.
Tell me about a challenging case you handled and the outcome.
The most challenging case I've handled involved a patient who presented with a severe allergic reaction during a procedure, which was entirely unexpected based on their preoperative screening. The patient, undergoing a minor orthopedic surgery, suddenly developed acute bronchospasm and a precipitous drop in blood pressure. The situation was critical, and we had to respond immediately. My first step was to remain calm and communicate the patient's deteriorating condition to the entire team. I clearly stated, "Patient is experiencing bronchospasm and hypotension." The anesthetist took control of the airway and blood pressure, while I focused on the immediate clinical support and documentation. I quickly located and prepared the necessary emergency medications, such as epinephrine and antihistamines, and ensured they were ready for the anesthetist to administer. Simultaneously, I assisted the surgeon in closing the surgical site to end the procedure as fast as possible, as a full-blown anaphylactic shock was a major concern. The entire team worked in synchronized motion. The surgeon was focused on securing the site, the anesthetist was managing the patient's vitals, and I was anticipating their needs, providing medications, and ensuring all actions were accurately logged. We managed to stabilize the patient, and the procedure was safely concluded. The patient was then transferred to the ICU for close monitoring. The outcome was positive. The patient made a full recovery with no lasting complications. This case was a significant challenge because it was an unforeseen medical emergency that required rapid, coordinated action. It taught me the immense value of effective team communication, proactive clinical thinking, and maintaining composure under extreme pressure. It solidified my belief that a well-prepared and cohesive team is the best defense against the unexpected in the operating room.
How do you handle a situation where you are unfamiliar with a specific surgical procedure?
When faced with a surgical procedure I'm unfamiliar with, my first and most critical step is to acknowledge my lack of specific experience and proactively seek to gain the necessary knowledge. Patient safety is my top priority, and working on a procedure without full understanding is a direct threat to that safety. My approach is systematic and begins well before the patient enters the operating room. I would immediately inform the charge nurse and the surgical team that I need to be oriented to this specific case. I would then dedicate time to a thorough preoperative preparation. This involves reviewing the patient's chart and the surgical plan in detail. I would consult the hospital's resources, such as procedure manuals or online databases, to familiarize myself with the surgical steps, required instruments, and potential complications. I would also ask for a brief, direct educational session with a surgeon or a more experienced perioperative nurse to walk through the key phases of the procedure and to clarify my questions. During the surgery, I would maintain heightened vigilance. I would function as a circulating nurse, ensuring that all necessary equipment is available and in working order, and meticulously monitoring the patient's status. I would remain in constant communication with the team, confirming each step and asking clarifying questions as needed. My role in this situation is to be a supportive and safe presence, ensuring that nothing is overlooked due to my inexperience with a specific procedure. The outcome of this approach is a safe and efficient surgical procedure, while I gain valuable experience and knowledge. My commitment to being a lifelong learner and my dedication to patient safety are what guide me in these situations.
Describe a time you had to deliver difficult news to a patient or their family.
Delivering difficult news is one of the most challenging yet essential aspects of nursing, and it requires a great deal of empathy and sensitivity. The time I had to do this was when I was caring for a long-term patient in a surgical unit who had been recovering well from a complex procedure. We had been hopeful for a positive trajectory, but a sudden lab result indicated a significant and unexpected complication that would require further invasive surgery. This was devastating news for both the patient and his family, who had been looking forward to his discharge. I knew this conversation couldn't be rushed. I first found a private, quiet space where we could talk without interruptions. I sat down with the patient and his primary family member, maintaining a calm demeanor and a compassionate tone. I began by acknowledging their prior hopes for his recovery, saying, "I know you were both looking forward to getting him home, and I'm very sorry to have to tell you that we found something unexpected in his lab results." I then explained the findings in simple, clear language, avoiding complex medical jargon, and gave them time to process the information. I focused on answering their questions honestly and directly. My role was not just to deliver the news, but also to provide comfort and a sense of control in a moment of great uncertainty. I reassured them that the entire medical team was dedicated to finding the best path forward. I offered to connect them with a surgeon again for a more detailed discussion and gave them a clear and concise overview of the next steps. I concluded by letting them know I would be there to support them through the entire process. This experience taught me that while the news itself may be painful, delivering it with compassion, clarity, and unwavering support can make a profound difference for patients and their families.
Why did you choose perioperative nursing as your specialty?
I chose perioperative nursing as my specialty because it perfectly aligns with my passion for patient advocacy and my desire to work in a fast-paced, highly technical environment where every action directly impacts patient safety. From the moment I first observed a surgical procedure, I was captivated by the precision, the teamwork, and the critical role the perioperative nurse plays in ensuring a successful outcome. It's a field that demands a unique blend of clinical skills, a meticulous attention to detail, and the ability to think critically and anticipate needs in real time. What truly draws me to this specialty is the opportunity to be the patient's voice when they cannot speak for themselves. The perioperative nurse is the final checkpoint before surgery, the constant presence during the procedure, and the first person the patient sees upon waking. This responsibility is a privilege, and I am committed to upholding it. My experience has shown me that my ability to remain calm under pressure, maintain a sterile environment, and collaborate seamlessly with the surgical team are my greatest strengths. I thrive on the challenge of being a crucial part of a cohesive unit, working together to achieve a common goal of providing the safest possible care. This is a specialty where I can continually learn and grow, mastering new technologies and procedures, while always keeping the patient at the center of my practice. I am confident that my skills and dedication are an excellent fit for the demands and rewards of perioperative nursing.
What qualities do you think a successful perioperative nurse should have?
A successful perioperative nurse must possess a unique blend of technical expertise and interpersonal skills. First and foremost, a high level of meticulous attention to detail is critical. In the operating room, a single oversight, whether it's a misplaced instrument, an incorrect medication dose, or a breach in the sterile field, can have devastating consequences for a patient. A successful nurse is a vigilant one, constantly checking and double-checking to ensure every step of the process is flawless. Beyond technical skill, calmness under pressure is an essential quality. The OR is a high-stress environment where situations can change in an instant, from an unexpected complication to an equipment failure. The ability to remain composed, think critically, and act decisively in these moments is paramount. A nurse who can maintain a steady demeanor not only ensures patient safety, but also provides a sense of confidence and stability for the entire surgical team. Finally, exceptional communication and teamwork are non-negotiable. The perioperative nurse serves as the liaison between the patient, the surgeon, and the rest of the team. They must be able to clearly and concisely convey critical information, anticipate the surgeon's needs, and collaborate seamlessly with colleagues to ensure a smooth and efficient procedure. This requires active listening, a respectful attitude, and the confidence to speak up and advocate for the patient. A great perioperative nurse is not just a skilled technician. They are a vital member of a cohesive unit, committed to a shared goal of providing the highest standard of care.
How do you stay updated with the latest surgical practices and technology?
Staying updated with the latest surgical practices and technology is a continuous and non-negotiable part of being a professional nurse. My commitment to professional development is ongoing, and I utilize several methods to ensure I'm always at the forefront of my field. One of the most effective ways I stay current is through formal continuing education. I regularly attend workshops, seminars, and conferences focused on perioperative care and surgical advancements. These events provide invaluable opportunities to learn directly from experts, observe new techniques, and network with colleagues. For instance, I recently completed a course on the latest protocols for robotic-assisted surgery, which has become increasingly common in our specialty. Beyond formal training, I am an avid reader of professional journals and publications. I subscribe to several peer-reviewed journals, such as the AORN Journal, which provides evidence-based research and best practice guidelines. This allows me to stay informed about new equipment, safety measures, and changes in surgical procedures. I also actively participate in unit-based in-service training and grand rounds, where new technologies or procedural updates are presented and discussed. I believe in a culture of shared learning, and I often contribute to these sessions by sharing knowledge I've gained from my independent research. Furthermore, I am a member of professional organizations, which provides me with access to webinars, newsletters, and a broader community of practice. This network is an invaluable resource for discussing new challenges and learning from the experiences of others. My approach is proactive and multifaceted, ensuring that my practice is not only current but also aligned with the highest international standards of patient care.
What do you find most challenging about working in the operating room?
The most challenging aspect of working in the operating room for me is the unpredictability of patient responses and surgical situations. While we meticulously plan and prepare for every procedure, the human body can react in unexpected ways. A patient's vital signs can suddenly change, or an unforeseen complication can arise, such as excessive bleeding or an allergic reaction to a medication. These moments require nurses to think and act swiftly under immense pressure. It's a test of our critical thinking, clinical knowledge, and ability to stay calm and focused when the stakes are at their highest. Another significant challenge is the high-stakes nature of communication. The operating room is a complex environment where every word matters. Miscommunication can lead to serious errors, so it's a constant challenge to ensure every instruction and piece of information is conveyed clearly and accurately. This is particularly difficult when dealing with a fast-paced or stressful situation. I have learned that a professional, respectful, and assertive communication style is essential to avoid misunderstandings and ensure the entire team is on the same page. It's a continuous effort to foster an environment where everyone feels comfortable speaking up if they have a concern, no matter how small. Finally, the emotional toll of caring for patients who are at their most vulnerable is a challenge. While we are highly focused on the technical aspects of the job, we must never forget that we are caring for a person who has placed their trust in us. Managing the stress of a long, difficult case and then being ready to give the same level of compassionate care to the next patient requires a great deal of resilience and self-care. It's a constant balancing act between the technical demands of the role and the human element of nursing.
What are your long-term career goals in perioperative nursing?
My long-term career goals in perioperative nursing are centered on continuous professional growth, specialization, and leadership. I am not simply looking for a job. I am seeking a career path where I can deepen my expertise and contribute meaningfully to patient care and the profession itself. Initially, my goal is to become an expert in my current role, mastering a wide range of surgical procedures and becoming a go-to resource for my colleagues. I want to build a reputation as a highly competent, reliable, and knowledgeable perioperative nurse. My long-term plan includes pursuing additional certifications, such as the CNOR, Certified Nurse Operating Room, which demonstrates a high level of specialized knowledge and commitment to the field. After gaining significant clinical experience, I aspire to transition into a more specialized area of surgical nursing. I am particularly interested in fields like robotic-assisted surgery or a specific surgical subspecialty, such as cardiothoracic or neurosurgery. I am keen to learn the intricate details of these complex cases and become a true specialist. Ultimately, my long-term vision is to move into a leadership or educational role within the perioperative department. I would love to become a clinical educator or a charge nurse, where I can mentor and train new nurses entering the field. I am passionate about creating a safe and supportive learning environment and passing on the skills and knowledge I have gained. My ultimate goal is to help shape the next generation of perioperative nurses, ensuring the highest standards of patient care are maintained for years to come.
How do you mentor or support new nurses in the OR?
Mentoring new nurses in the operating room is a responsibility I take very seriously, as a strong foundation is crucial for their success and for patient safety. My approach is structured around three key principles: providing a supportive learning environment, encouraging critical thinking, and empowering them to find their voice. First, I create a supportive and non-judgmental environment. The ER can be intimidating, and new nurses often feel overwhelmed. I start by normalizing their challenges and encouraging them to ask any and all questions, no matter how small they seem. I make it clear that their learning is a priority and that they are never to feel like a burden. This open-door policy builds trust and confidence. Second, I focus on encouraging critical thinking, not just rote memorization. Instead of simply telling them what to do, I walk them through the why. For instance, when we are prepping a patient, I explain the rationale behind each step, from using a specific prep solution to the exact draping technique, connecting each action back to the prevention of infection. I present them with hypothetical situations and ask them to think through the best course of action, which helps them develop their problem-solving skills for future independent practice. Finally, I empower them to advocate for patient safety. I teach them to be the patient's final checkpoint and encourage them to speak up if they see something that doesn't seem right, whether it's a discrepancy in a patient's chart or a potential break in the sterile field. I assure them that their voice is valuable and that their concerns will always be taken seriously. By combining practical guidance with an emphasis on a strong safety culture, I aim to not only train a new nurse, but to cultivate a confident and highly competent professional who is ready to thrive in the demanding environment.
What is your approach to giving and receiving feedback from colleagues or superiors?
My approach to giving and receiving feedback is built on the principles of respect, honesty, and a shared commitment to continuous improvement. I view feedback not as a criticism, but as a valuable tool for professional growth, both for myself and my colleagues. When I am giving feedback, my method is to be direct, constructive, and timely. I believe it's most effective to address an issue as close to the event as possible, in a private setting, and focus on the behavior or situation rather than the person. For example, instead of saying, "You are disorganized," I would say, "I noticed that the instrument tray wasn't set up in the usual order today, and it made locating the tools more difficult during the procedure." I would then offer a solution or ask how I can help. The goal is to improve a process and help my colleagues succeed, not to tear them down. When I am receiving feedback, my primary goal is to listen actively and openly. I take a non-defensive stance and recognize that the feedback is likely coming from a place of wanting to help. I ask clarifying questions to ensure I fully understand the points being made. For instance, I might ask, "Could you give me an example of a time when my communication could have been clearer?" I take the feedback to heart and reflect on it later to see how I can integrate it into my practice. I also believe in closing the loop by thanking the person for their honesty and, when appropriate, sharing the positive changes I have made as a result. This creates a cycle of mutual respect and growth that is essential in a collaborative team environment like the operating room.
Tell me about a time you demonstrated leadership in your role.
Demonstrating leadership is a continuous process in nursing, and a time that particularly stands out for me was when I identified a recurring issue with instrument count discrepancies in our operating room. Although these were always resolved before the patient left the OR, the problem was causing significant delays and creating unnecessary stress for the team. I recognized this wasn't just a procedural issue, but a systemic one that needed to be addressed to enhance both patient safety and team efficiency. My goal was to lead a change in our process to eliminate these discrepancies. I began by meticulously tracking the incidents over a 2-week period, observing when and where the errors were most likely to occur. I found that the discrepancies were most frequent during long, complex cases with multiple instrument sets. Instead of simply bringing the problem to my manager, I developed a solution-oriented proposal. I suggested a new protocol that involved a mid-case mini-count for high-volume instrument sets, a change that would allow us to catch and correct errors in real time. To gain buy-in, I presented my findings and proposed solution to my colleagues during our daily briefing, emphasizing how this would improve patient safety and reduce our end-of-case stress. I also spoke with my manager, outlining the data and the expected positive outcomes. I took the initiative to train my colleagues on the new protocol, demonstrating the process and answering their questions. This leadership by example, rather than by title, fostered a sense of shared ownership. As a result of implementing the new protocol, we saw a dramatic reduction in count discrepancies within the first month. This not only improved our overall efficiency, but, more importantly, enhanced our commitment to patient safety and built a stronger, more collaborative team environment.